Loudoun County's Emergency Medical Services Transport Reimbursement Program is scheduled to begin July 1st, 2014. With the EMS Transport Reimbursement Program, fire and rescue officials will bill insurance, Medicare or Medicaid, when someone is transported by an ambulance to a medical facility.
Our goal is to make the Emergency Medical Services Reimbursement Program as invisible to the public as possible. We want you to call 911 just as you've always done at the earliest onset of a medical emergency. We're going to serve you as you've always been served, and if you can't pay the bill due to financial situation, then we're not going to take you to collections. We don't want the presence of reimbursement to be a deterrent to calling 911. Call 911 as quickly as you can.
Loudoun County's fire and rescue system members strive to provide the best emergency medical service possible to residents and visitors. They carry out that mission with competence, compassion, and a sense of duty to the people they serve.
We are a combination system of both career providers and also volunteer providers. However, the care that is provided to the citizens and visitors of our community is the same care. Anything that the physician would be able to do initially at the hospital is the same thing that our technicians or our paramedics could do on the scene.
When a person is transported by ambulance, the charges are based upon the level of emergency care provided. The billing program is based on concern for the medical and financial health of our residents. It is designed to minimize the out-of-pocket costs for residents. For instance, your insurance company, Medicare or Medicaid, will be billed first. You will then receive a bill for any co-insurance or deductibles.
We plan to put those funds raised from the reimbursement program directly back into our EMS system, whether it's supporting training, purchasing equipment, or purchasing ambulances. An ambulance costs well over $250,000 to purchase, an additional $100,000 to equip with state-of-the-art equipment.
If you are unable to pay because of a financial hardship, the county will not pursue payment and will not refer the bill to collection. No one will suffer financial hardship as a result of an emergency medical transport.
People will not be treated differently based on their ability to pay or not. We treat everyone the same, and there's nothing that's going to prevent us from continuing to provide the best possible care.
At no point is the intention of this program to prevent individuals from accessing the 911 system or being provided appropriate emergency medical care.
In addition to this commitment, Loudoun County Fire and Rescue System personnel will continue to protect patients' privacy with strict adherence to the Health Insurance Portability and Accountability Act standards. Ongoing training will ensure compliance with HIPAA requirements.
Citizens don't need to worry about their personal information going anywhere. That information is protected under HIPAA. The information on our patient care reports is going to be extracted by the third-party biller for the purposes only of processing the reimbursement.
All funds received through the program will be directed back into the fire rescue system to include volunteer companies. This revenue will pay for training, equipment, specialty apparatus, and support personnel, allowing us to continue to provide quality care with competency and compassion.
The cost to provide EMS care is very expensive, so some of the reimbursement is just going to provide a fraction of the cost that it is to actually run a call, and we have to find different ways that we can try to recoup some of that cost. Reimbursement is one way to do that, but it's important to remember that the volunteers in our community are a very important part of our system, and they still rely on the donations of the community.
We encourage folks not to think twice about contacting 911 at the earliest onset of a medical emergency. We want to provide the service. You need the service as quickly as you can. Dial 911. We will be there to serve you first and foremost. We want to provide you quality emergency medical service as quickly as we can.